So I'm going to now try to decipher where the vector is coming from for the hip. So I'm going to correct the hip, and then as I'm correcting, listen for where any pulls are, and then as I let the hip correction go, feel for where the vector takes me. So take your weight again over onto the left leg. And bring your weight back over. Okay. So I have the correction, and then as I let the correction go, the hip is pulled medially and anteriorly. Now I would take the patient onto the couch to have a feel in an unweighted position. I'm now just going to do a bit of vector analysis on the left hip, which is a technique called soap on a rope. So I'm going to just distract through the hip joint, and as I let go slowly, feel for where the vector takes me. And as I come up, I'm pulled medially and internally rotating with the femur. And on palpation, there's quite a tight fascicle in an adductor here. So I'm going to just bring the leg up slightly, and I'm going to facilitate shortening the origin and this insertion, and just try and get this muscle to dampen down and relax off. I'm going to cue for the patient to just feel for where my hands are and try to soften the muscle, let go, that's good. And as I can feel that, I can then take the leg into a stretch and see then when I retest if that's let go, and that's a bit better, and then I can feel for any other vectors. So we've released the vectors of the adductors from the medial thigh, and the hip position in general is better. So is the foot. The knee is still a little bit valgus, so there might just be some local release that we need to do around that. But the pelvis, the clavicle and the cranium are in a more neutral position. Now the other vector or resistance that I've been feeling as I go to correct the left hip is a short vector around the back near the ischial tuberosity, and on palpation I can feel that the left side of coccygeus is tight. And so if I just give some feedback into that muscle, and I'm going to say to the patient to really just try and relax where my finger is now and feel that soften. Okay, and now come down into your squat. And back up. And how did that feel?
Not much better.
Okay.